Namaste all. This video is to explain the procedure of Kapalbhaati, which is a cleansing process or one of the Shuddhi Kriyas that are mentioned in Hatha Yoga. Kapalbhati is to be practiced sitting comfortably. You can be seated on your yoga mat, or if you're not able to sit down in this cross-leg position, you can also practice it on the chair. If you are seated on the chair, make sure that you are sitting at the edge of the chair and not like leaning back like this, keeping your spine straight, long, and erect. Make sure your feet are completely resting on the floor if you are sitting on the chair. If you are sitting on the floor or on the yoga mat in cross leg position, there are a couple of things that you should pay attention to. One is that your spine is not rounding like this. If you feel a pull, backward pull naturally, then what you need to do is you need to use a blanket or a pillow and sit on a pillow. I always recommend that even if you do not feel a pull backward, then sitting on a slightly raised platform like this, even this much of height is good enough. It gives your spine a very good lift, and that helps in directing the flow of the energy while practicing any kind of pranayam. Of course, Kapalbhati is not a pranayam, it is a Shuddhi Kriya, but because it deals with the breath, we always want to keep our chest open, our shoulders broad and wide, and our spine long, straight, and erect in all the practices that are related with our breathing. So we assume this position. Those of you who can sit in Padmasana can also sit in Padmasana like this. But this is optional, okay? This is not mandatory. You can also be seated in a simple cross-leg position. If your knees lift up like this, then you may want to give support under your knees. So you can slide some pillows, or if you have yoga blocks, you can support your knees with the block, right? So we assume this posture, then keep your hands on the knees, cup your knees with your palm. Kapalbhati is defined as active and forceful exhalation and passive inhalation. What does that mean? We keep exhaling actively. That doesn't mean we don't inhale. We do inhale, but inhalation is passive. So inhalation happens on its own in between two exhalations. Now exhalation is active and also it is forceful. So when you exhale, what happens to your belly? Your belly moves in towards the spine. Your belly moves in towards the spine, just like a balloon. If you fill air into the balloon expands. And when you start releasing the air from the balloon, it has to shrink. So this balloon, when you exhale, it has to go in. So this is the movement of the abdomen that happens with exhalation, right? So in Kapalbhati, you're going to exhale actively, forcefully. In one stroke, you exhale, you pull the belly in, and through your nostrils, you push the air out. So let's see. Sitting in a comfortable position, hands on your knees, eyes closed. You can first watch, understand, and then practice. So see, at a very comfortable pace, I start exhaling. The pace needs to be very, very comfortable. While you exhale, you need not move your shoulders up and down. So don't do like, not like this. You need not tense the muscles around your throat and need not use your vocal cords a lot. So if you feel that there is a lot of um, dryness you feel after the practice of Kapalbhati, then probably you're using a lot of throat and you're making some unnecessary sound. So pay attention to that. Make sure you don't do it and start progressing slowly. So this speed is good enough to begin with. Then you can start speeding up like so, one stroke of exhalation per second that can be achieved. And then slowly, slowly, you could reach up to 120 strokes in 1 minute. But remember, how many strokes you're doing in a minute doesn't matter if you're doing it once in a while. All of these yogic practices are best done on regular basis if you really want to get benefited from those practices. So Kapalbhati is one of those practices, right? Now, who should not be doing Kapalbhati? If you have high blood pressure, then avoid doing Kapalbhati or do it at a very, very, very comfortable uh, pace. Secondly, if you have any kind of lower back pain, then I would suggest that you go against the wall. So sit against the wall. Your back, your spine will be resting against the wall. Okay. So that care you can take. Secondly, if you are having cold, cough, then during that period, it's better to avoid menstruation, pregnancy, avoid this practice. Otherwise, you can surely do this practice. So let me know if you've understood the practice and thank you.